Hello, my name is Mark Linderman. I work for the Wayne County Health Department in Richmond, Indiana, and I'm a full-time environmental health specialist for the health department, meaning I take care of things such as food inspections, animal bites, West Nile virus, the spread of those diseases. But one of the things I also do, one of my passions, is preparedness or public health preparedness. And what does that entail? Well, you look at some of the implications of natural disasters here in the world, or whether it be a pandemic or a bioterrorism attack. What role does public health play in such a scenario? And so that's a little bit about what I want to talk to you about today. My background is in film and television production. That's what I went to school for. That's what my degree is in. And by happenstance, I came to the Wayne County Health Department and took over their television program. But in 2001, September 11th, 2001, that changed my outlook on life tremendously. And when you look at disasters always happen at the local level first. You respond to disasters on the local level first. And so, even though I was doing this segment of my life where I was focusing on film and television production and the other environmental health sciences, I really had a calling, maybe if you will, to learn more about preparedness, not just on a broader level, but on a very personal level as well. Since I've been the preparedness coordinator for the health department for going on 2.5 years, I've learned a lot. And one thing I learned about plans is you never stop planning. There's no such thing as a set plan. It's always morphing, it's always evolving, and it's a living, breathing thing. And the more you learn about your environment or where you live, what kind of hazards face you locally, the more your plan changes. But the biggest thing I've learned in the past 2.5 years is relationship building. Without relationships in preparedness, it's going to be very hard to actually get anything accomplished in your community because you try to go it alone. And if you think about worst case scenarios, let's say a massive earthquake does rip through Indiana, the New Madrid Fault finally breaks after all this time, people aren't going to be able to go it alone. We're going to need each other, and we're going to need those relationships. We're going to need to borrow things from other people. We're going to need to borrow expertise from other people. And people come and go. So you had to reestablish all these relationships all over again many times. And so the thing about a preparedness plan is it's just a plan. I think Mike Tyson was the one that says everybody has a plan until they get punched in the face. And so we look at what we do here on a preparedness level, not just as public health officials, but emergency management officials, Red Cross, the hospitals. Mental health is something that we've learned a lot about in the past couple of years. Where does mental health fall into your disaster preparedness plans? All those things play a role in your overarching plan. Every single piece is very vital. After 9/11 had happened, a lot of people were very focused on their own organization, meaning public health had their own little silo, if you will, that they worked within. Emergency management had their own little silo that they worked within. Law enforcement, fire, hospitals, so on and so forth. And no one really knew how to play well together as far as exercising, as far as getting their plans in sync with one another. And so when a disaster happened, take Katrina, for example. There's a lot of things that went wrong with Katrina, and communication and relationships that should have been built weren't. And so Katrina was, if nothing else, among a horrible thing, was a good test case as far as why it's so vital and so important to build those relationships, to exercise together, to put those other organizations within your own plan beforehand. Because making a plan during a disaster doesn't really work that well. But just relatively recently, within the past 3 or 4 years, the CDC has tried to implement an all hazards approach to public health planning, meaning how do we respond during a tornado outbreak? How do we respond during an earthquake? What do you do as a health department when your health department doesn't stand any longer? What if your infrastructure is demolished? How do you respond? How do you operate as a public health agency. And the same thing goes along with each different disaster. And you really prepare for each disaster exactly how you would prepare for a pandemic or a bioterrorism attack. You just kind of had to tweak your plan a little bit. But the concept is still there. You had to be prepared for every contingency. You have to be or at least knowledgeable of what could happen to your community. What kind of disasters can happen to your community? Where do those fall into your plan? And so your plan should really reflect what kind of relationships you have with other preparedness agencies. But it should also reflect how well are you prepared for other disasters to happen. How well are you prepared if the power goes out in your department? Where do you find the power to refrigerate your vaccines? Where do you find the power to keep any computer data system that you have going up and running? I think one of the things that affected me most past 9/11 was the H1N1 pandemic. I was amazed by something that could be so small that started in Mexico City, end up in my own living room 2 months later. My family had H1N1. I was the only one vaccinated at the time, so I was the only one who actually didn't get H1N1. But I was just amazed at how something so small could potentially devastate the entire world. And that might sound a little cavalier on my part, but I truly was just overblown by the potential of a nightmare scenario. How do we plan for a pandemic? And in your plans, it's always vital to plan worst case scenario. If you plan for anything less than that, then you're really not planning to succeed, you're planning to fail. And it might sound somewhat morbid to think of worst case scenarios. It might sound a little bit morbid to think, what do I do with 100 dead bodies? Where do we put those bodies at? Do you have a morgue big enough? And you start thinking, maybe I don't. And you start thinking about things like refrigerated trucks, as far as storing bodies. It's not always a pretty scenario that has to go through your mind when you think of such a thing. But again, you always have to plan for the worst when you write your preparedness plans. Obviously, you can't prevent every single disaster or every single disease that comes your way. There's no way that we're going to be able to prevent an earthquake or a tornado. But what you can prevent is the furtherment of disease spreading. As far as the public health risks to people, those are some things that you can prevent. You may not be able to prevent all of them, but you at least can take those steps prior to learn how you can prevent at least some of them, to lessen the effect of a pandemic, to lessen the effect of a disease outbreak during flooding, for example. And then you ought to be able to assess along the way, how are you doing with those plans? And you assess by constantly having exercises, whether it be a tabletop exercise or a full-scale exercise. Sometimes we assess our capabilities through flu clinics. We have a drive-through flu clinic at least once or twice a year. We assess how that goes, because if we had a massive outbreak of a disease or we had a bioterrorism attack, we have our plans to use a drive-through clinic to have people drive through their cars, get the vaccines or get the pills that they need. Over time, those plans change. We tweak, we learn what we've done wrong, but we can't do that if we don't assess throughout the year our capabilities and our understanding of the disaster and our plans. We recently just had a hazard vulnerability assessment through Purdue a couple years ago, and it took various disasters, whether that's a blackout, whether that's a nuclear attack, whether that's a disease outbreak through mosquitoes, so on and so forth. And how does our organization here, or how does our health department stack up in preparing and mitigating and responding to such events? And so I think it's an important thing to be able to do that, because when that day comes, you're going to make sure that you're able to respond to those disasters. If worst case scenario happens and a disaster comes, surveillance plays a big part of that. How do you perform surveillance on disease outbreaks? How's the disease spreading through your community? Tuberculosis, for example. Where are your eyes on the spread of tuberculosis in your community? How many people do you know who have been affected with it, and where do you go from there? What's your plan say about TB? How do you respond to vector-borne diseases? Do you have a a part in your plan where you can survey those diseases or the potential of those diseases and a response effort to those. Do you have a vector control plan in your overall preparedness plan? And then finally, you just want to be able to survey your efforts, survey the community, and make sure that you have a recovery plan if something happens. I've talked to a lot of people, a lot of my counterparts in other counties, and they always say recovery is the hardest part of your preparedness plan, and actually the hardest part to actually do if a disaster happens, because the recovery process is so lengthy. The recovery process has a lot of paperwork, and to be able to get people back up on their feet and moving again can really take a toll on yourself, your organization, the other organizations around you. But those things need to be put in your plan so you at least have an idea of what to expect. Some of the things that I've learned along the way, which I think really kind of piqued my interest and actually worry me the most when we prepare, are things like fatality management. Again, what do you do with people who have died when you have a mass amount of deaths during a disaster, whether it's, again, through an earthquake or tornado or a pandemic or a bioterrorism attack? So things have to be done with bodies, otherwise disease begins to spread. And as far as your fatality management plan, what do we have? I think another thing that really, worries me is medical surge. And surge is pretty much your capability to handle an overwhelming amount of people coming to your organization. We as a health clinic here really don't deal with medical emergencies. We farm those out to our local hospital. But regardless, we are a medical facility, and even though we may not handle those things, the general public doesn't always see that, and people think, act, and react differently during disasters. So they see us as a health clinic, and so I can almost guarantee that people will start coming to our health clinic during a disaster seeking medical care. So how do you handle those people? Do you have a plan to triage different people as far as who is the most need of medical care versus those who might just think they really need emergency medical care? And how do you have those plans with your hospital to actually help triage those patients? But what I've learned in the past couple of years is it does not take a whole lot to overwhelm a hospital, for example. In reality, let's say there's a flu outbreak and people get admitted to the hospital, they go through the ER. How many people can the ER actually manage before they become overwhelmed? One of the things that you really need to focus on are your vulnerable populations. What's a vulnerable population? It could be an age. Our seniors here in Wayne County, we have various senior homes or senior housing. How do we respond? How do you help that community? We have a very large Amish community here in Wayne County. Do you have a plan to assess to see if they're even a vulnerable population to begin with? For example, during H1N1, the CDC gave us certain requirements on who received the vaccine first. And at the top of that list, obviously, were younger aged people, but also pregnant women. So during that time, pregnant women were a vulnerable population, as long as the younger and the mid-level or mid-age populations. And so vulnerable populations not only needs to be assessed in your community, but also planned for as far as how you respond to those people. And one of the things that I am most fascinated about are the social implications of a disaster. And part of those social implications are how do you respond, how do you communicate to your public? And that's one of the things that I've utilized my background in film and television production and preparedness, or my love for preparedness, and kind of specialized in crisis and emergency risk communications. How do you respond to the media? How do you get the information out to your community during a disaster? And we've done several things here, some very cutting edge things here at Wayne County to be able to do that. We have implemented, for example, a film and television program here in Wayne County. We're the only health department in Indiana that does such a thing, probably one of the few handfuls of health departments in the nation who have done such a thing. And it's one of those things that we've done very well. We're a 2-time Emmy-nominated health department as far as a television program goes. We've won 15 national awards for our production work. We're starting to veer into social media a lot more. But one of the things that I truly love is how do you respond, again, how do you communicate during a disaster? I've been to the CDC to receive training to instruct other organizations on how to manage those capabilities, those communication capabilities, to teach them right and wrong practices on how to communicate to the public. And I'm one of the only instructors in Indiana on the local level to actually be able to be certified by the CDC to teach that. Because communication during a disaster is so vital to be able to get that information out and to not overwhelm people, to not give them more than they can handle at the time, but to give them steps to do, the knowledge that they have to have during that moment to take care of themselves, to take care of their families, and to prepare for what could come next, whether that's recovery, whether it's more of the disaster. People really want to know. As a public health organization, one of the first and foremost things that we operate in well, or should operate in well, are points of dispensing, or a pod. For example, we set up a pod every time we do a shot clinic, whether that's immunizations or flu vaccinations. During H1N1, we took over one of our community centers to set up one of our pods where several hundred people within Wayne County came in to get their pandemic flu H1N1 vaccination. The pod is the head of the spear for public health, because our role really in public health is to get shots in people or pills in people, depending on the scenario and the disease. And so pod management, pod layout, and the plans to implement your point of dispensing are so vital in your preparedness plans. One of the things that really piqued my interest is pandemic preparedness, and also power outages caused by, it could be whatever, it could be electromagnetic pulse, which right now is a very real scenario that America faces through other countries. What do you do when you don't have refrigeration capabilities for vaccines, for things like insulin, for things like sanitation? Where do you go to get those things? And what happens during a mass power outage? What happens during a pandemic when your workforce is cut by a third and people aren't there to turn the power on in your community? What happens with law enforcement and people who think you might have a vaccine that you don't have, or try to come to your organization looking for a vaccine that's stored elsewhere? What do you do as an organization to help prepare for those things? And sanitation really comes into play when you look at workforce reduction, when you look at power outages, and how do they affect you personally on your family level, locally, and very well regionally. And one thing to remember about preparedness, especially during a widespread disease like a pandemic, every community is by themselves. And that might sound a little harsh, but in reality, every community is facing the exact same problem that you're facing. A pandemic isn't localized here to Wayne County. It's local. It's spread all around to surrounding counties, to surrounding states, and people have to deal with their own problems. And so I go back into the concept that every disaster is a local disaster first. And to be able to respond locally is vital, because you may not get support from the state for several days or weeks. And the same thing goes with the federal government. And so your preparedness plan always has to be focused on local efforts before state efforts and federal efforts can be accounted for. I want to thank you for your time and for watching this relatively brief introduction into public health preparedness, as far as what I do here at the Wayne County Health Department and what other local health departments are also planning to do. The one thing I just wish you could take away from this is that, again, your plan is a living, breathing thing. It's constantly being updated and worked on. And the disasters happen on the local level first. They're going to affect you guys before they affect the people surrounding you. And relationship building is so vital as you work on your plans. Go out and meet these people if you haven't already. Go ahead and establish memorandums of understanding or MOUs with them, and work on those relationships. I've heard of some counties that don't play well as far as their preparedness organizations within their old local community. We're very blessed here in Wayne County. Every preparedness organization works extremely well with each other. We're all friends. We all maintain those friendships. There's not a month that goes by that we don't work with each other in some aspect or another. And so I just really want to encourage you to work on those relationships, because when the disaster happens, you're going to really have to rely on those relationships to give the best response effort as you can, and depend on these other organizations as you will, to make sure that your community is as safe as they possibly can be and recover as quickly as they possibly can recover. So again, thank you for your time. I hope that you can take some of this information and get started with it. If you have any questions, feel free to contact me or Dr. Coulter at any time. Again, thank you and have a great day.